Hello, this is Dr. Grande. Welcome to my video on the theory of Adlerian therapy. Developed by Alfred Adler, Adlerian therapy is considered a psychodynamic therapy. And we'll start by looking at the theory of personality. The first area I'm going to cover under theory of personality is what Adler referred to as the style of life. And the style of life indicates how an individual adapts to challenges and overcomes challenges, how well they develop solutions. It's formed by early childhood experiences, and most of the components of the style of life are established by age 5. How the style of life is formed is related to family dynamics, and of particular importance to Adler was birth order and the personality traits of the family members of the client. Next, we have social interest, and this was also an important part of the theory of personality according to Adler. And you could think of social interest in terms of aptitude and ability. Individuals have varying levels of aptitude for social interest and ability to exercise or express social interest. Adler believed that there was an innate cooperative aptitude in all individuals, and that starting early in life, individuals express cooperation through activities, mostly through social activities. He believed that early significant relationships were important to the formation of social interest, and there was a particular emphasis on the parent-child relationship. Adler also used social interest as a method of assessment, and he viewed low social interest as being associated with poor mental health, and a high level of social interest as being associated with good mental health. Now, it's important to recognize at this point, because I mentioned assessment, that Adler and Adlerian counselors do not place an emphasis on diagnosis, but do have methods of assessment like this example of social interest. So moving on with theory of personality, we'll next take a look at inferiority and superiority. So we'll start with inferiority. In Adlerian therapy, there's a belief that all individuals, especially when they're young, have perceived weaknesses, and that when there's healthy development, there's a compensation for these weaknesses. Early on, as Adler developed Adlerian therapy, he emphasized physical inferiority, but toward the end of the development of the theory, he emphasized social inferiority. And that remains the emphasis for many Adlerian counselors now, the social inferiority component as opposed to the physical inferiority component. If the compensation for weaknesses does not occur, an inferiority complex can develop. And this is characterized by feelings of inadequacy, hopelessness, and the belief that there is not enough strength to solve problems, particularly social problems. Then we have superiority, and that's a striving for excellence. And generally, Adlerian therapy views striving for excellence and superiority as good constructs, as positive constructs, positive and healthy. However, an overinvestment in the striving for excellence can result in a superiority complex. And that's characterized by arrogance, an individual that's demeaning of other individuals, and self-centeredness. So moving on to the cause of symptoms in Adlerian therapy, Adler believed that underdeveloped or low social interest led to mental health symptoms. Also, maladaptive responses to genetics and to the environment. And this highlights an important point of Adlerian therapy. Adler didn't believe that mental health symptoms were caused by genetics, and he didn't believe that they were caused by the environment. He believed that the cause of symptoms was the way that an individual reacted to or responded to their genetics and their environment. And this quality differentiates Adlerian therapy from many of the theories of counseling. An incomplete or insufficient adjustment to feelings of inferiority can cause symptoms in Adlerian therapy, under the theory of Adlerian therapy, as well as an obsession with gaining power. So the incomplete adjustment to feelings of inferiority can lead to an inferiority complex, and an obsession with gaining power can lead to a superiority complex. So now taking a look at the techniques used in Adlerian therapy. And we'll start with mutual respect and trust in the counseling relationship. So for Adler, there was a real emphasis on developing a healthy and productive therapeutic alliance. And that's something we would expect currently from most of the theories of counseling. But at the time when Adler was developing this therapy, many of the predominant theories did not emphasize the therapeutic alliance, particularly not a therapeutic alliance the way that Adler envisioned one, where there was mutual respect and trust, and that was an important part of a client's progression through counseling. Another technique was the collection of information that was related to the style of life, that would give the counselor information related to the style of life. And this includes early memories, early recollections from the client. Also, it included what Adler referred to as basic mistakes, which are self-defeating behaviors or self-defeating attributes of a client's style of life. Now, these basic mistakes vary from client to client. They're individual based on the client. However, there are some general categories that a lot of basic mistakes fall into. For example, expressions in which a client minimizes their own worth as a human being, an overly negative view of how demanding life can be. For example, if a client indicates that they are incapable of accomplishing their goals or they'll never accomplish their goals, that's an indication of a basic mistake. And overgeneralizations represent basic mistakes. For example, if a client indicates that everyone dislikes them or everyone believes that they are a failure, that's an overgeneralization and a basic mistake. Information is also collected related to strengths and weaknesses, which is not surprising given the emphasis on inferiority and superiority. And there's also information collected on family relationships and birth order. Now, I mentioned birth order previously when discussing the style of life, when introducing that concept. And it's important to recognize here that Adler believed that if you had the information on birth order, that you could draw useful conclusions from that, meaning there was an impact of the birth order on the client. And he divided that impact into 5 different positions. There is the only child, and Adler believed that the only child does not learn to cooperate well with other children, but does learn useful social skills in relating to adults. Then we have the oldest child, and Adler believed that the oldest child sometimes had to take on the role of the parent, was generally a high achiever, was often the center of attention, and favored by the parents. However, the oldest child was also at risk to be spoiled. Then you have the second of two children, and Adler believed that this child often behaved as if they were in a competition, specifically in a competition with the oldest child. Then we have the middle child, and here Adler felt that the middle child often feels pushed out of the family, feeling pressure from both older and younger siblings. And then we have the youngest child, and Adler felt that the youngest child was at risk to be rebellious and to be pampered, but was also creative. The next technique we have is the interpretation of dreams. And in Adlerian therapy, dreams are used to gain insight into the current style of life and to measure progress in therapy. So the interpretation of dreams in Adlerian therapy is quite different than the interpretation of dreams in psychoanalytic therapy and in analytic therapy. Similarly, Adlerians do interpret transference and resistance, but it's generally with the same goal in mind as is the case with dreams: to gain insight into the current style of life. This technique can also be used to help the client gain insight and understand the meaning or purpose of thoughts, feelings, and behaviors. Encouragement is a key technique in Adlerian therapy, and it builds on the idea of the construction of a therapeutic alliance. And encouragement is also used to assess the current style of life. Next we have role-playing. And role-playing, as it's used in Adlerian therapy, is typically seen at a point where the counselor is trying to help the client assess the utility of new behaviors and to decide whether they want to try those new behaviors or not. Another technique that's tied in with trying out new behaviors is the acting as if technique. And again, this is used when a client is considering trying a new behavior, and what the counselor here does with the acting as if technique is to ask the client to act as if the new behavior will be successful. So it's similar to a behavioral experiment in behavior therapy. The push button technique, on the other hand, is very similar to cognitive therapy. In the push button technique, a client is asked to recall a pleasant memory or time in their life, and then to identify the feelings associated with that recollection of memory. And conversely, they're asked to remember a time that wasn't so pleasant, and then again to identify and express the feelings that they have after that recollection. So this technique is designed to help clients gain insight into the fact that they do have an ability to influence their own feelings. And this technique serves to help them develop that ability. So with the push-button technique, there's a real parallel to a lot of the techniques we see in cognitive therapy. And in line with cognitive therapy, I believe with the push-button technique, the same cautions need to be observed, particularly when asking a client to reflect on a negative experience or an unpleasant experience precautions need to be taken to make sure the client is ready for that and that that will be beneficial for them. Then we have the catching oneself technique. And in this technique, the counselor explores with the client ways to detect undesirable behaviors that the client has identified that they want to change, and catch themselves before they complete those behaviors or before they start those behaviors. So again, you can see here a parallel to cognitive therapy. For example, when cognitive therapists work with clients to identify automatic thoughts, as well as identify feelings and behaviors that are unpleasant or are the focus of change. Next, we have paradoxical intention. And this technique, of course, reminds us of strategic family therapy. This is a technique where the symptom is prescribed. So in this case, if a client exhibits a particular behavior, and it's important here to clarify that caution must be used when selecting a particular behavior for this technique. But when a client has a specific behavior that is, again, a focus of change, that they exaggerate the behavior. They try to exhibit the behavior more, and in doing that, realize the true nature or cause of the behavior and gain insight. Just like with strategic family therapy, paradoxical intention must only be used with caution, because there are definitely certain symptoms or behaviors that counselors would not want clients to exaggerate or express to a greater degree, as they are harmful. The last technique here is homework. And again, this reminds us of cognitive behavioral therapy, but homework was a significant part of Adlerian therapy. And the type of homework we see assigned in Adlerian therapy is usually tied to a behavioral goal. So it's usually a concrete behavior that would be accomplished between sessions. And of course, this homework would be tied to the client's broader goals, the reason they came to treatment in the first place, or a goal that they discovered along the way. And speaking of goals, we'll take a look now at the goals in Adlerian therapy. One is to change self-defeating behaviors. For example, correcting the basic mistakes. Another is to increase social interest. And again, Adler associated an increased level of social interest with good mental health. So this is an important goal in this theory. Another goal is to develop problem-solving skills. And again, this goal sounds very much like cognitive behavioral therapy as well. And then we have the goal of creating a more adaptive style of life. So now for the last slide in this video, and this is where I offer my opinion about how components, elements, or items of a particular theory, in this case, of course, Adlerian therapy, how these pieces of a theory can be integrated into a counseling style. So these are the areas of this particular theory that I believe can be usefully, productively integrated into a counselor's counseling style. These can be useful. And the first here from Adlerian therapy is the therapeutic alliance. In this theory, the therapeutic alliance involves mutual respect and trust, and I think this is a component which can be fairly easily integrated into our counseling style. And this type of therapeutic alliance is relatively popular among many of the theories of counseling. The next component is the idea of interpreting transference and resistance. And I don't use this as much in the sense of trying to determine a style of life, as in the theory of Adlerian therapy, but more to help the client gain insight. When you have transference, when a client projects feelings onto you that they actually have for another significant individual in their life, or there's resistance in the counseling sessions, those instances are worth talking about, and oftentimes insight can be gained through that discussion. The next component of Adlerian therapy I think can be useful is encouragement. And again, I believe this particular technique, as well as many of the items in Adlerian therapy, have a parallel with cognitive behavioral therapy and many other popular therapies. And I think it's important to encourage clients and to communicate that encouragement to them. So this is an item that, again, I think can be fairly easily integrated into a counseling style. I believe role-playing can be helpful, role-playing in the counseling session. We see that in Gestalt therapy, we see that in cognitive behavioral therapy and other therapies. In Adlerian therapy, role-playing is used when a new behavior is being considered, but there are actually, I think, a lot of opportunities to use role-playing with clients, not just when a new behavior is being considered, but also, for example, if there is a particular conflict that the client is having in a relationship in their life and they want a safe place to role play that conflict. And of course, we would see that more in Gestalt therapy. Then we have the acting as if technique. I believe this technique encourages clients to try actions that can be potentially symptom reducing. We have the push button technique, as I mentioned, very similar to several theoretical concepts in cognitive behavioral therapy, and like all components of counseling must be used with caution, but can be a useful technique. And then we have homework. And again, homework I view as a technique which can be easily transferred into a lot of different counseling styles. And I particularly like homework that's related to a behavioral goal, something that's concrete, something that you can define with the client. It can be narrow in scope, and whether that homework is completed or not can be easily assessed. Either the behavior was demonstrated or it was not. And depending on how well homework progressed, the next homework can be assigned and can build on that, or maybe take a step back and try another behavior that's more likely to be successfully implemented. So to summarize, Adlerian therapy is considered a psychodynamic therapy, and certainly it's clear that there are definitive psychodynamic components to it, but it also has techniques and underlying theoretical constructs that relate to Gestalt and cognitive behavioral therapy. It's a goal-oriented therapy, and a lot of the components of Adlerian therapy can be very useful when integrated into a counseling style. I hope you found this video on the theory of Adlerian therapy to be useful. As always, if you have any questions or concerns, feel free to contact me and I'll be happy to assist you.